Okay, fantastic. All right, good evening everyone, and welcome to Take Charge for April of 2015. Tonight we're going to be listening to a speaker who's going to talk to us about something called sleep apnea. Sleep apnea is a condition where you find yourself throughout the evening periodically, you just stop breathing. And as you can imagine, that's not a good thing to do. There's many bad health effects associated with sleep apnea. And as we start learning more and more about it, we're realizing that it's a little bit more common than we had initially anticipated, and it does have an effect on your heart health. So today we're going to be listening to Dr. Monique Mendelsohn. She's going to explain all the ins and outs about sleep apnea, so we'll know what it is, what causes it, how it's managed, and what does it do to us, especially from a heart point of view, if we don't look after that particular condition. Dr. Mendelsohn, thank you very much.
All right, well, thanks very much, Rob. So I'm very pleased to be here this evening to talk to you all about sleep apnea and your cardiac health. So I'm going to start by introducing myself. I have a PhD in exercise physiology, and I did my studies in a town in the French Alps called Grenoble, which you see in the picture right here. It was very lovely, and and now I'm here working at Toronto Rehab as a postdoctoral fellow, and I'm working out of the sleep lab, which is downtown on University Avenue, and also out of here at the Cardiac Rehab Center, because I'm doing a project that's on the effects of exercise training on sleep apnea in patients with coronary artery disease. Okay, so I'll talk about that at the end of my talk, but and for now I'm going to tell you a little bit about what I'm going to be talking about this evening. So Rob went over it briefly, but I'm going to start by defining sleep apnea. What is sleep apnea? What is the prevalence, or how frequent is it in the general population, and also how frequent is it in a population of people with cardiovascular disease? We're going to talk about symptoms of sleep apnea, some of the risk factors for sleep apnea, and the consequences of sleep apnea on your health. Okay? We will also discuss the different scientific evidence that's supporting a link between sleep apnea and cardiovascular disease. And I'll also be talking about how sleep apnea is diagnosed and how sleep apnea is treated, and also what are the effects of treating sleep apnea on your health. Okay, so throughout the talk, please feel free to interrupt if there's something that you don't understand, if something's too technical, or if you can't hear me, or if I talk too fast. Please do just lift your hand and ask questions as they come. Because if you're not understanding something, then it's very likely that someone else is also missing some information. Okay? So we're going to start with the definition of sleep apnea, which Rob briefly defined for us. Now, I hope I'm not disappointing anybody, but the apnea fairy does not exist. But if she were to exist, this apnea fairy, she would be waking you up throughout the night several times. So anywhere up to 70 times an hour, she would come and wake you up for a brief moment, and then you'd resume breathing and fall right back asleep. Now, the term apnea means a temporary pause in breathing. So sleep apnea is defined as repetitive pauses in your breathing throughout the night that are followed by an awakening for you to resume breathing. Now, these breathing pauses can last anywhere from 10 seconds to over a minute. And they can happen up to 70 times per hour in very severe cases. So there are two types of sleep apnea. I'm going to start by defining the more common type, which is obstructive sleep apnea. So obstructive sleep apnea occurs when your airway or your windpipe becomes partially or completely blocked many times during sleep. So if you look at this drawing on the left here, you see an opened upper airway. Okay, so the air is flowing nicely in and out towards the lungs. Oxygen is coming in, carbon dioxide is going out, and the air is flowing freely. Now, in the case of a closed upper airway, which would cause a pause in your breathing or an apnea, your tongue and your soft palate come and obstruct that airway, okay, and this causes a blockage of the airflow. Okay, so one sign of this blockage of a reduction in the airflow is snoring. Okay, and when the airway is completely blocked off, it is silent. So there's no longer snoring. So the result of this interrupted breathing pattern throughout the night is fragmented sleep. So your sleep isn't very good quality because you're waking up repetitively throughout the night. And the goal of the awakening is to regain muscle control and reopen that airway to resume breathing. Okay, now this is the more common form of sleep apnea, but there is another form of sleep apnea that is much more rare. It affects less than 1% of the general population, and it's called central sleep apnea, and it's quite a bit more complex. So I'm not going to explain this graph here because it's just to show you that it's not just the airway that's being blocked off, but it is a lot more complicated. And what happens with central sleep apnea is that the cause of the pauses in breathing are due to failure of the brain to send messages to the respiratory muscles to breathe. So this is different from obstructive sleep apnea, where the airway is being closed off because the throat muscles are relaxing. In this case, it's the brain that's not sending proper messages to the respiratory muscles to breathe. Now, central sleep apnea is very uncommon in the general population, but it is very common in patients with heart failure. So we'll talk about that a little bit later, in that relationship between central sleep apnea and heart failure. So what are the consequences of sleep apnea? So to understand what's going on during a breathing pause, you're probably wondering why there's a milkshake there. I'd like to use the analogy of this milkshake analogy. So imagine you're trying to drink this delicious strawberry milkshake through one of those paper straws. You know, they're sort of decorative, they're not very firm. So if this is a thick milkshake, you'd be applying a lot of pressure to try to get that milkshake in. And what would happen is that straw would collapse because it wouldn't be strong enough to deliver the milkshake to your mouth. And that's kind of what happens with the airway during an apnea, during a breathing pause. During normal breathing, when you're awake and your airway is nice and open, that's kind of like drinking this milkshake with a plastic straw. It's a lot easier. The milkshake actually gets into your mouth, and it's probably quite delicious. And the straw isn't collapsing. So when we sleep, there is an increased risk for the airway to collapse and to close off. And this is particularly true when we sleep on our backs. So in most people, this collapse doesn't happen because the throat muscles are able to keep the airway open. But in people with obstructive sleep apnea, the muscles aren't responding adequately around the airway. And like that paper straw that collapses, the airway collapses and air isn't reaching the lungs. Okay? Now, what happens to the rest of your body and your body function when the airway is blocked or partially blocked? So when during the apnea or during the breathing pause, your level of oxygen in the blood is decreased, okay? And the level of carbon dioxide, which is a waste product of metabolism, rises because you're not able to get the oxygen in and the carbon dioxide out. So when breathing resumes, the size of the airway will remain reduced in size for some time. It doesn't automatically open and become completely open again. And that usually causes snoring. So when someone has an apnea and breathing resumes, often it's followed by a snorting sound or a snoring sound before the snoring becomes regular again. So that's what causes that snoring when the person wakes up after a breathing pause. So what are the effects of an apnea or a breathing pause on, again, on your overall function? So these repetitive awakenings that are happening throughout the night are often, firstly, the person with sleep apnea is often not aware of any of these awakenings because they're so short. They're just long enough for the person to regain the ability to breathe, and they fall right back asleep. So this results in a significant reduction in the actual duration of sleep. So even if the person is sleeping for 8 hours, or they think they are sleeping for 8 hours, all these awakenings are actually reducing the total amount of sleep time, and also the quality of sleep, because the sleep becomes less efficient. It can cause fatigue and daytime sleepiness. and concentration and memory problems because of this alteration of the sleep quality. Now, some other physical effects are physiological changes that will affect the heart and the blood vessels. So during a breathing pause or an apnea, your heart rate is increased and your blood pressure also rises, and this results in increased release of stress hormones and compounds that cause inflammation. So having all these periods where your breathing is paused during the night is actually stressing your heart significantly. So let's talk a little bit about the prevalence of sleep apnea, or how many people are affected by sleep apnea. So we'll start with obstructive sleep apnea. Now it affects up to 15 million adult Americans, and the landmark study, one of the first studies to investigate the prevalence, was done in 1993 in Wisconsin, where they took a whole cohort of Wisconsin state workers, about 1,500 of them, and they've been following them for the past 26 years, or more now, because it was in 1993. So since 1993, they've been following them every 4 years. They come in for a sleep study, and they measure a lot of other outcomes related to their health. Now, in 1993, they found that only 4% of middle-aged men and 2% of middle-aged women had sleep apnea. Now, more recent studies are reporting numbers that are quite a bit higher. It's more like 20% in men and 10% in women. And the reason for this increase in the prevalence of sleep apnea is also the parallel increase in the rise in obesity over the past, since 1993, and also increased access to diagnostic treatment and increased awareness about sleep apnea. People are talking about it more, people are more aware of it, so are more likely to get tested if they have any symptoms. Now, central sleep apnea, as I said, was the more rare form of sleep apnea, and it affects less than 1% of the general population, and it occurs mainly in patients with heart failure. Okay? So now if we look at the prevalence in people with cardiovascular disease, so have any of you ever had a sleep study done before? Okay, it's quite a few. And how many have sleep apnea? Okay, so how many got tested and were found to not have sleep apnea? Okay, so there are a few who had it. Okay, very, very interesting. So the studies that have looked at the prevalence of obstructive sleep apnea in patients, in people with cardiovascular disease, have found that the prevalence is 2 times higher than in the general population. And with respects to central sleep apnea, though it affects very little of the general population, in patients with heart failure, it can affect anywhere from 40 to 80% of people. So it's very frequent in patients with heart failure. So we're going to talk a little bit about some of the symptoms of sleep apnea, of obstructive sleep apnea. And here they are enumerated here. So there is excessive daytime sleepiness, so feeling like you could fall asleep in front of you feel like you can nod off very easily in a variety of different situations, in front of the TV, after a meal, in a waiting room, all kinds of different situations where you feel like, whoop, you could just nod off. Snoring is another symptom that's hard to know if you're snoring yourself unless you record yourself, but often your bed partner, if you have one, will complain of your snoring and will give you the good elbow nudge to let you know that you're interrupting their sleep. Another big one, and probably the most important symptom, is actually when your bed partner will witness you having these pauses in breathing. So often in someone with sleep apnea, they will be snorers, so they'll snore throughout the night, and there will be numerous periods throughout the night where there'll be a pause, and that's when the bed partner will go, ah. But it's actually not that, it's not a good sign, because it means that that person has actually stopped breathing, and the breathing resumes with a loud snore or snort after anywhere from 10 to 60 seconds. So bed partners are very, very important in identifying sleep apnea if they're interested in watching their bed partner sleep, which is also a difficult thing to do. Now, someone who has sleep apnea can have episodes of awakening at night where they feel short of breath or where they feel like they're gasping for air. So this would happen right after an apnea, where you wake up and you feel like you need air. And other symptoms are problems with memory and concentration, changes in mood, or particularly depression, and a general feeling of fatigue. Now, these are symptoms of obstructive sleep apnea that are for anyone, okay? It's not specific to people with cardiovascular disease. And the reason I'm saying this is that there have been some recent studies that have looked at some of the signs and symptoms of obstructive sleep apnea in people with cardiovascular disease, and they find that they don't always have this typical presentation of symptoms. They actually are, a recent study that looked at a whole cohort of people with obstructive sleep apnea found that those who were the least symptomatic, so who complained the least about this daytime sleepiness and of problems with sleep, were people with cardiovascular disease. So that's just something that I want to point out, because these symptoms, you know, even if you don't have symptoms of sleepiness, it doesn't mean you don't have sleep apnea. Okay? Now, some of the risk factors for obstructive sleep apnea. So one of the big ones is being a man. So unfortunately, or fortunately for women, unfortunately for men, being a man means that you're twice as likely to have sleep apnea than if you were a woman. However, women do increase their risk after menopause, and they also increase the risk if they're overweight. Now, excess weight is another big one. So, and that's because fat deposits around your throat and your upper airway can obstruct your breathing and can predispose to having these breathing pauses throughout the night. Now, saying that excess weight is a risk factor doesn't mean that because you're thin, you're not at risk for sleep apnea. About 2/3 of patients with sleep apnea are overweight or obese, but that leaves 1/3, about 33% of people with sleep apnea who are thin, who are of normal weight. So again, it doesn't mean that because you're not overweight that you don't have a possibility of having sleep apnea. Now, age is another risk factor. So the risk for sleep apnea does increase as you age. Family history of sleep apnea. So if you have people in your family who have sleep apnea, this also does increase your risk of having sleep apnea as well. And then there are some other things. Oh, well, there's also alcohol consumption at bedtime or late in the evening. Now, that's because alcohol will relax the muscles of your upper airway and predispose to having these breathing pauses. And then there are some other anatomical features like craniofacial abnormalities, so people who have a retracted jaw, and then anatomical features having a large tongue or enlarged tonsils, or having nasal obstruction. So whether it be from having allergies, when you have a period of allergies, you may notice that you snore more, and this is actually also predisposing you to be more likely to have sleep apnea. Now, we talked about central sleep apnea and how it was more prevalent in people with heart failure. Now, the risk factors for central sleep apnea some are similar to those of obstructive sleep apnea. Age and gender are two big risk factors for central sleep apnea. But two of the other important risk factors are having congestive heart failure or atrial fibrillation. This does increase your risk to have this specific type of sleep apnea, which is central sleep apnea. Also having a stroke or a brain tumor, and the reason for that is that these conditions can impair the brain's ability to control the respiratory muscles and to initiate breathing and prevent those breathing pauses throughout the night. So, to go over the signs and symptoms of sleep apnea again, these are two questionnaires that are used to screen for sleep apnea. They're called the STOP and the BANG questionnaire, and that's just because of the acronym that you see underlined in red there. So in the STOP questionnaire, the questions relate to snoring. So do you snore loudly? Do you often feel tired, fatigued, or sleepy during the day? So symptoms of sleepiness. Has anyone observed that you stop breathing? So that's the witnessed apneas. And do you have or have you ever been treated for high blood pressure? Now, there is a link between hypertension and sleep apnea, so that's the reason for that question. And then the BANG questionnaire will ask about weight status. So is your body mass index or your BMI greater than 30? kilos per square meter? Are you over 50 years old? Is your neck circumference greater than 15.75 inches? And are you a man? So if you score greater than 3 on either of these questionnaires, you are considered at risk for sleep apnea. Now, the thing with these questionnaires, and when they've been used in populations of people with cardiovascular disease, is that they've found that they have high sensitivity. Now, what that means is that there's a very high proportion of people who will score high on these questionnaires. So a study that was done here at Toronto Rehab on about 300 patients in the cardiac and diabetes program found that 80% of patients scored high on these questionnaires. So if you go through the questions, I'm sure quite a few of you will say yes to at least 2 of the questions on either of the questionnaires. So it's very unlikely to miss anyone, but it's possible that someone who scores high does not have sleep apnea. So these are just, these questionnaires are interesting, but they are limited in use because they do get a lot of false positives. So it's not because you score high on these questionnaires that you have sleep apnea, but they are, quite a few of the risk factors are enumerated there. So now we'll talk a little bit about the health consequences of sleep apnea. Now, the list of diseases that you see here and the numbers that are associated. So for example, for drug-resistant hypertension, in people who have drug-resistant hypertension, up to 83% of those people have sleep apnea. So these are all based on scientific studies. In obesity, people who are obese, the prevalence, the likelihood of having obstructive sleep apnea is all the way, can go up to 77%. Now that's in severe obesity. And congestive heart failure, the prevalence of sleep apnea is up to 76%. People with pacemakers, 59%, atrial fibrillation, 49%. And people with type 2 diabetes, up to 48% of people with type 2 diabetes also have sleep apnea. And all hypertension, so not only drug resistant, but also just regular hypertension, up to 37% of people with hypertension have sleep apnea. And coronary artery disease, up to 30% also have sleep apnea. So why does sleep apnea increase the risk of having these other health problems? So we know that having sleep apnea, having these repetitive pauses throughout the night, raises the heart rate and raises the blood pressure, which places significant stress on the heart. So this could be because these apneas are causing that decrease in the amount of oxygen in your blood and the rise in the CO2, and also activating the branch of the central nervous system that is responsible for increasing heart performance. So that's some of the reasons that these conditions coexist. And now we're going to talk a little bit about the link and the scientific study that supports the link between sleep apnea and cardiovascular disease. So this here is results from a very large study that was done in over 1,500 men. So it wasn't men and women, this was only men, who were followed over a period of over 10 years. So they had annual visits, including sleep studies, every year. And the authors of this study were able to do an analysis of the risk of cardiovascular events because they followed these patients long enough. And this is what they found. So if you look at the red curve here, this represents people with severe, untreated obstructive sleep apnea. Okay? So what this means here is that they had a greater risk of having a cardiovascular event when compared to controls. So a control is someone who doesn't have sleep apnea, or compared to people who do have sleep apnea but who are treating their sleep apnea. Okay, so this was one of the biggest studies done that really supported the notion that sleep apnea does increase the risk for cardiovascular events. Now, some questions about the link between sleep apnea and cardiovascular disease. One of the big ones is, does sleep apnea contribute to the development of cardiovascular disease? Or rather, which one comes first? Did the sleep apnea cause my cardiovascular disease, or did my cardiovascular disease cause my sleep apnea? Now, this first question is very hard to answer, unfortunately, because we don't know the history of sleep apnea. in everybody. Not everybody goes in for annual visits to the sleep lab, and you'll see why a little bit later. Not only are they expensive, but they're also not very fun. And so we don't know at what point a person developed sleep apnea and at what point they developed cardiovascular disease and which one came first. So unfortunately, there's no studies that have been able to investigate that. But what we do know now is that, to answer the second question, does sleep apnea in patients with established cardiovascular disease accelerate disease progression? And the answer is yes, with what we just saw. We saw that having severe obstructive sleep apnea and leaving it untreated does increase your risk for cardiovascular events. Okay, so now we're going to talk a little bit about diagnosis and treatment of sleep apnea. So how is sleep apnea diagnosed? So for those who have already had a sleep study before, they know all about it, and they can tell you how great it is. Now the gold standard for diagnosing sleep apnea, this is a picture just to know what to expect if you ever do have a sleep study. And what I've shown here is the amount of information that we get when you do a sleep study. So even though all these wires are very uncomfortable, and we do get a lot of very valuable information which allows us to have a very robust diagnosis of whether or not you have sleep apnea. And we're also gathering very relevant information about your sleep patterns, the different sleep stages, and I'll enumerate everything that we measure just so you have a full idea of how relevant all these wires are. Now the biggest concern for people coming in for a sleep study is how are they ever going to fall asleep with all these wires. Now it's extremely rare that people are unable to fall asleep completely. They may struggle a little bit more to get comfortable because rolling over with the wires is a bit of a challenge, but it is possible. And for all those who have had sleep studies before, I'm sure they'll tell you that they probably don't get as good a night's sleep as at home, but they did manage to sleep, and the amount of sleep that they got was enough to have that important information to diagnose or to rule out sleep apnea. So here's a woman who is loving having her sleep study. So she's also showing you all the different wires involved. So what we measure during a sleep study are your brain waves. So that's the sensors that are placed on your head, and the point of those sensors is to be able to know whether you're sleeping or you're awake and in what type of sleep you are in, if you're in a deep sleep or a light sleep. We also look at eye movements, chin muscle activity for people who grind their teeth, airflow through the nose and mouth. Now that's obviously related to sleep apnea. We need to see if you're breathing or not. And there's also bands around your chest and your abdomen to see the breathing movements. We measure blood oxygen levels, heart rate and heart rhythm, and leg movements. Okay, so all those wires do have a purpose. It's not for fun. Maybe one day we'll get a technique that's just as robust as this with maybe a little less wires. But for now, unfortunately, we do have to deal with all these wires and find a way to fall asleep to have a sleep study done. Now, the severity of sleep apnea is appreciated with the apnea-hypopnea index. So this refers to how many breathing pauses happen during sleep per hour of sleep. So it's not per hour of the whole recording, it's actually per hour of actual sleep. So less than 5 events, so an event is a breathing pause, so less than 5 events per hour is considered normal. Between 5 and 15 events per hour is mild sleep apnea. Between 15 and 30 events is moderate sleep apnea. And more than 30 events or more than 30 pauses in your breathing per hour of sleep is considered severe sleep apnea. Yes?
This is on your back.
What's that?
This is on your back.
No, this is in any position. So we also do calculate something called the supine apnea-hypopnea index, and that will look at your apnea-hypopnea index when you're lying only on your back. Because when people come in for a sleep study, they don't only sleep on their back. They're free to move from side to side. And there also is video recording in the room, which allows us to see in what position the person is at all moments throughout sleep. And the sleep tech is actually, when you roll over onto your right side, is putting a little note on that report that you saw to say left side sleeping, right side sleeping. So that is a good question, because some people do have sleep apnea which is positional, and that's related to the position in which they're sleeping, and it's often on their back. But that's not everyone. That's just a small percentage of people who have sleep apnea. So some people are also having sleep apnea when they're sleeping on their side.
What's exactly a breathing pause?
A breathing pause is when your breathing stops. So your airway or your windpipe is closed, and air is no longer going in. Okay? So now we're going to talk a little bit about treatment of sleep apnea. Now the most common treatment for sleep apnea, and also the most efficient, is something called positive airway pressure, or CPAP, which is the most common form. Now some of you may know CPAP, some of you may use one of these devices at home. So CPAP is a treatment in which a small mask is placed over your nose or over your nose and mouth, and compressed air is blown into the lungs. So what that air is doing is acting as a splint to keep your airway open and to prevent your airway from collapsing. So to make sure that you're getting air in and air out, and that you're not having any of those breathing pauses throughout the night. So this is the most common form of treatment for sleep apnea, and it can be successful, but to be effective it does have to be used when sleeping, and preferably throughout the whole night, which is a challenge for some people. But it is most effective. Its effectiveness is directly related to how long it's being used throughout the night. So people who have moderate to severe sleep apnea may benefit from this type of treatment. But now we're going to talk about some of the benefits of treating your sleep apnea. So this right here is charts from the same study that we talked about earlier, and that looked at long-term cardiovascular outcomes in men with sleep apnea. So we saw earlier on that slide that having severe untreated sleep apnea increases your risk for cardiovascular events. And this here is just to show you again that even though you have obstructive sleep apnea, if you are treating your sleep apnea with CPAP, then you're reducing your risk for fatal cardiovascular or non-fatal cardiovascular events. And people who have obstructive sleep apnea and who are treating it with CPAP are at a similar level of people who do not have sleep apnea. So you're reducing your cardiovascular risk quite significantly. Now some other benefits of treatment of sleep apnea. For coronary artery disease, some observational studies suggest that CPAP is associated with a decrease in the occurrence of new cardiovascular events, which we mentioned. Another study showed that using CPAP for 1 month can improve daytime blood pressure, heart rate, and left ventricle function. Now, a study in stroke and heart failure saw that with CPAP treatment, the risk of stroke is reduced by 35%, and the risk of heart failure is reduced by 20%. And in people with diabetes, they found that treatment with CPAP is associated with a reduction in blood glucose levels and increased insulin sensitivity with compliant CPAP therapy. So all these studies are looking at people who are compliant to their CPAP, so not just taking it home, but using it and using it for a significant amount of time. And also hypertension. Now, one study found that effective sleep apnea therapy was associated with a 10 millimeter in mercury drop in blood pressure. Now, that was a study where compliance was very high. Now, when they've looked at a whole cluster of studies, because a lot of studies have looked at the effects of CPAP on blood pressure, the results have been a lot lower. It's more like a drop in 2 to 3 millimeters of mercury. But the result is significant compared to not treating your sleep apnea.
Is there any negative ones?
So you're...
Negative effects?
No, these are, what do you mean by negative? A decrease in blood pressure.
Yeah, I know, but is there any negative effects of using the machine?
Not that have been documented.
Okay.
Yeah. Now, the other treatment options that exist, so when CPAP proves to be unacceptable, some other treatment options do exist. In some cases, oral appliances can be used. Now, the goal of an oral appliance is to reposition the jaw, and this isn't for anybody, but for some people this can work. And it acts by pulling the lower jaw and the tongue forward to increase the size of the airway. Okay? Now, these devices do have lower success rates at relieving sleep apnea compared with CPAP. Now, the question that you asked about positional sleep apnea, So some people have a type of sleep apnea that's called positional sleep apnea, which means that they're only having sleep apnea when they're sleeping on their back. So unless they're very set on spending the rest of their lives sleeping on their back, in which case CPAP would be necessary, there exists some very non-invasive ways to treat that type of sleep apnea, which are called positional therapy. So you see this man over here with his lump of something on his back there. Now that is something called an anti-snore shirt. And what it does is that it's a piece of mousse that's, you know, sewn into the back of his t-shirt, and it's preventing him from ending up on his back. So if he were to roll over, I mean, I think it's pretty impossible for him to roll over on his back, but if he were to try, he would immediately realize that it's impossible and he would stay on his side. And in which case, for this fellow here, if his sleep apnea was only related to sleeping on his back, then this would be an effective treatment. Now, you can do this kind of shirt on your own by taping some tennis balls to the back of a t-shirt, or buying a pool noodle and just taping it to the back of your shirt. But this is only used in people who have positional sleep apnea. Okay? Now, this isn't a treatment option, but this is more of more advice, is to avoid alcohol or sedatives at bedtime, because those do predispose to sleep apnea and make you more prone to have apneas throughout the night. And now another treatment option are lifestyle modifications. Now, weight loss is a big one. Now, obesity is one of the most important causes of obstructive sleep apnea. And the most striking results on the effects of weight loss on sleep apnea come from bariatric surgery studies. So they have people who are signed up to have bariatric surgery, do a sleep study, they have their bariatric surgery, and then they have another sleep study following the bariatric surgery, and they find a quite drastic reduction in the severity of sleep apnea. So in those people, you know, weight loss has not necessarily entirely alleviated their sleep apnea, but has reduced it quite significantly. Now, another one is exercise. So if you're all here, exercise is part of your everyday life. So that's a great thing. And the studies on exercise and sleep apnea have shown that exercise alone, without any change in weight or in fitness level, results in a 32% decrease in the severity of sleep apnea. So that's in people who are, you know, who are not exercising, who become exercisers. And so this has brought us to explore the underlying physiological mechanisms that explain how exercise is beneficial for people with sleep apnea. So that brought me here to Toronto to do a study on sleep apnea and exercise. So unfortunately, the study is nearing the end, but it's not quite finished, so I won't be able to share all the results with you today. But I will show you just quickly the study design. So we recruited patients from here, from the cardiac rehab program, who were enrolling to begin their cardiac rehab. So we recruited them out of the labs after their initial cardiopulmonary assessment, and we had them come downtown to Toronto Rehab at the University Centre to do an overnight sleep study. So following that overnight sleep study, those who had sleep apnea were invited to participate in this study for 4 weeks, where they were either in an exercise group, which means that they got a head start on the exercise before starting the cardiac rehab, so they'd come walk on the track with myself for 4 weeks, or a control group, which would just maintain their regular activities until beginning the cardiac rehab. And then after that 4-week period, they had another cardiopulmonary assessment to see if there were any changes in their fitness level, and another sleep study. So they got to do 2 sleep studies in a month before beginning their regular cardiac rehab. So again, unfortunately, I don't have the results, but this is a study that we've been doing here for about 8 months now that's coming to an end. So I'm resuming regular sleeping patterns, which is great. And hopefully in the future we'll be able to share these results with you, but they do go in the same sense that exercise is beneficial for sleep apnea. Yes?
Can you give us some sense for the intensity of the exercise?
So the exercise was very similar to what patients do when they start the program here. So it was designed by the patient's cardiac rehab supervisor, and the beginning of the exercise was done just as someone who would start the program here. So they did their exercise trial on the track, and with the results from that exercise trial, they were given an exercise prescription that was designed by the cardiac rehab supervisor.
So it would be different for each of the 22?
Yeah. well, it would be a different, it would be this similar intensity, but different, a different quantity and different speeds. But relative to the person themselves, it was a similar intensity.
I understand that is also some kind of surgery performed in the throat
Yeah.
to control or moderate the effects of apnea.
Yeah, so there are surgical procedures that exist, but they are used sort of as a last resort. We try conventional therapy first, and in some cases it can be indicated, but it's not common to be referred right away for surgery. Yeah.
You found that 4 weeks is enough to give you the data and to have an effect on the speech?
So that was a concern, but we found that so far it looks like it is enough. And it seems like the effects are probably more acute effects rather than chronic. So just that 4-week period seems to be enough. And a recent study that was done in 2014 used a 5-week period, which is just slightly short, just slightly longer. And they found that same 30% decrease in the severity of sleep apnea with only 5 weeks of exercise. Yeah.
Where can we get a copy of the study when it's released?
Well, look up my name on the internet. It'll probably be posted. There's a wall in the hall down there where there are like a bulletin board where the recent publications come out. So I'll make sure that it gets posted up there. So just watch that bulletin, the research bulletin board.
I can email it out too.
Sure, or Rob can email it out. I'll be sure to share it. And that's it. That's the end of my talk there. So.